Oh. Battery life, that's, look at some battery. Be able to do it. Already. You just need double A. It's double A.
Check, check. 1, 2, 1, 2, 1, 2. Check, check. 1, 2.
Brian getting this one for battery. Oh, okay.
There's fresh striped donuts in the oven.
That's your second donut today. They're warm. Yeah, just a second. Good, so we are.
Good deal. Check, check. 1, 2, 1, 2.
Better go potty. Okay, so make sure. Oh, how do I get this out? Person, face, run my. Oh, I was like, there's somebody's face in my screen. I'm like, oh, there's people online.
Yeah, yes, there are
Okay,
people
so
online.
how do I
Um,
move this box?
So actually, there should be. This is the here.
Yes,
this is
I needed my notes, that's all, I was just.
Oh, yeah,
making-
yeah, you're good to have a note up here. It's already.
Okay, how do I go, okay, I'm gonna move this down here, so then there, we on,
There could be, we can't tell right now,
Okay. so,
but I'll be monitoring that.
okay, I'm just gonna go back, I was trying to make sure my notes were there.
Hey Matt, this is Tawny. It's just currently me in the chat in the room digitally.
Just talking away.
Okay, but you should, skip, this works.
Okay, fantastic.
Right time.
Now, do I need to, I gotta put this one?
Yes, because that's how they're gonna hear you online.
Okay,
So, yeah, if you can use that and whatever you need to with this, and I'll be in here and Tony's gonna help me with the chat.
oh, okay, fantastic.
Okay, I'll be in a room with you.
Okay, all right. Delivered? You want one? No. No.
They're like the best in town. Yeah, they're the best in town.
Really?
Striped on, and they're still warm.
Oh, my goodness.
Yeah, of course, enjoy that. Stripes. Harrisburg.
Okay, man. Yes, I'm good, and I don't think that there was a, you know, there's people.
Yeah, okay, gotcha, no problem, whatever you want.
Okay.
I'm just trying to make sure it works.
Yeah, he was coming by, I'm like, don't.
They just put them in the kitchen or.
Right. Right, right. The last one, the base. Really. And it's a big problem, look.
There's a lot of people that are checking out. and stuff like that.
Of course, no problem.
But anyways,
Okay,
welcome everybody online and in the room. Thanks for joining us. If you want to look up the bios for our next presentation, go ahead and do that. We can get to the meat of it. I'm going to turn things right over to you, Michelle. So.
thank you so much, and I appreciate being here with you all. It has been great, time dealing with, this is my first time at Northport, as well as first time to visit. So this is great.
I better use the mic. I'm gonna try to do this and see if I'm coordinating. Is that getting feedback? Or is that the truck? That's the truck. It's okay. It's the truck. No, a truck went by. It was false alarm. It was a truck. Yeah. For those online, we are having quite the comedy scene here. Okay. Right. So my name is Michonne Mayfield. I'm the Director of Business Development at the Quad A, and I'm so excited to talk to you today about some of the things that we talk to our facilities about, and we want to help them mitigate risk through compliance and ongoing monitoring. Now, our mission is very clear: patients first and always. It's just that simple. So I hope today through this presentation that you'll learn the overview of the accreditation process, as well as how we educate facilities to help improve patient safety through proactive accreditation preparation, ongoing oversight, and tips to avoid deficiencies. Through the presentation, you'll learn about Quad A itself, as well as the outline of the accreditation process and how to actively prepare and stay in compliance with the standards, ongoing oversight, as well as deficiencies, and again, tips for compliance. Now, the programs that we have all outpatient programs, including pediatric dentistry, which we launched in 2019. We have 3 programs that are approved and were deemed by Medicare to conduct surveys for ambulatory surgery centers, outpatient physical therapy, as well as rural healthcare. Where the individuals, the programs that we and associations that we are partnered with are through the states. We have approval through California, New York, Florida for accreditation for their outpatient surgery programs. We have international programs as well, and we are IEEA certified. We have over 3,200 facilities accredited nationwide and through the worldwide as well. Now, we appreciate being able to partner with national associations such as NARC and NOSOR, and we do frequently have touch points with CMS. As we are a deemed accrediting organization, we do provide data with regard to compliance. It is the entryway for facilities to become Medicare certified, so we do actively work with CMS on a regular basis. We train our members to have surveyors that are knowledgeable about our standards. NARC serves as an outlet where we provide information related to standards changes. Our surveyors are medical professionals in the industry, allowing them to be up to date with industry standards. We have a peer-based survey process, so you know that a lot of the surveyors that are coming in are actually practicing in those settings. We present at state and local association meetings, as we are with this one. And we recently presented at the Rural Health Association of Tennessee, so we're very excited about that opportunity. We meet with CMS routinely and discuss performance, proposed rules, changes to guidance, and emerging trends in healthcare. Now, our duty as an accrediting organization is to make sure that we're assessing for patient safety. We aid in making sure that our facilities have standardized practices. We want to make sure that they understand the requirements with regard to the federal guidelines and make sure that they're in compliance as well. We have ongoing data-driven standards revisions. We get information and feedback through our survey process to make sure our standards are current and relevant. And we educate facilities and decrease vulnerabilities in delivery of care. I think through the accreditation process, we want facilities to understand about ongoing compliance and monitoring. We want them to understand the ongoing quality improvement measures that they should be undertaking as an organization to ensure that they're providing the best care. Now, staying up to date with industry standards, we notify state agencies and CMS regional and central offices with regard to the accreditation standards. We leverage CMS and other training sessions to provide training and reference materials to our surveyors. Our clinical team, we have 5 nurses actually, that makes up our clinical team, and they provide training and education modules to improve standards application and interpretation, as well as the consistency of the standards and the process. Our position allows us as an intermediary between the provider community and regulators, asking questions of facilities that are afraid to ask, and helping to obtain and provide clarification on interpretations to assist the facilities through the accreditation process. Now, the great thing about our organization is that we want to provide the facilities as much information as possible in preparation for the standards, in preparation for the survey, I should say. So we provide the standards complimentary basis on our website. The facilities can download them and prepare adequately in advance for the survey. We want them to make sure that they understand what the standards are and how they apply them in their practice. We want 100% compliance as well. We provide them checklists that they can use to prepare for the survey and ensure ongoing compliance. We have a clinical records worksheet that's on our website, as well as a personnel records worksheet. And we encourage facilities to use these on a regular basis to prepare and, again, to sustain compliance. The CMS guidelines, we want to make sure that the facilities are well equipped with the current CMS guidelines. We provide them Appendix G and Appendix Z for emergency preparedness as well. We want to make sure that any updates to CMS requirements, we let them know through our accreditation process. And also state and local requirements. We want to make sure that the facilities are well versed and know that they have to be in compliance with their local and state regulations. So as part of this process, we try to arm our facilities with as much information to prepare adequately for the survey. Now, let me talk to you a little bit about the accreditation process itself. This is a general overview of the accreditation process, both pre-survey and post-survey. And we want to show that the process is very simple and very clear, and it is a very achievable thing. Accreditation and compliance with Medicare requirements is very achievable. Now, when the facilities submit their application to Quad A, we provide them with their own dedicated accreditation specialist who reviews the materials to make sure that they're complete, and especially in accordance with what is required by Medicare. The survey itself, once we actually get the surveyor committed to the survey, and is unannounced, by the way. All Medicare surveys are conducted on an unannounced basis. The survey is the opportunity for the surveyor to better understand what the facility does, walk through the facility, make sure that they're meeting key staff. They're doing a document review as part of the pre-survey, as well as on-site during the survey, looking for the materials that would demonstrate the facility's compliance. They're having interviews with patient and staff. That's one of the things that is important as part of the survey process, is that they observe patient care. They observe patient interactions with clinical and non-clinical staff. And throughout this survey period, they're collecting information with regard to the facility's compliance. They're preparing this information so that they can convey to the facility very clearly what their identification of compliance or non-compliance was. They're very clear with regard to the facts of the survey. They want to make sure that they convey very clearly what the findings were and why they were not in compliance with the standards. Once the survey process is concluded, then we do report this to Medicare. And as I described earlier, the pathway to Medicare certification is through the accreditation process. So if they want to become Medicare certified for the first time, they come through an accrediting organization, and then we recommend to Medicare, yes, they have complied with all the requirements. Here is our recommendation for Medicare certification. The decision is not up to an accrediting organization, by the way. It is up to Medicare whether they become Medicare certified. Our process is such that once they have the on-site survey and they adequately complete the process, they do have a triennial accreditation, but we do have touch points throughout their accreditation term so that they have to demonstrate to us that they remain in compliance. So we actually require them on an annual basis to provide us with a self-assessment of their compliance. And so this is our way of making sure that we're staying in contact with the facility throughout their triennial accreditation. Because we know in some instances that the state has not been in for quite some time. We also ensure that we actually have boots on the ground in every setting when a facility moves or undergoes a major remodel. Our board is adamant that another survey occur, and especially with Medicare, Medicare has to approve that move. So we do have to have another survey if any changes like that occur. And through that self-assessment process, again, this is a mandatory process that they must complete prior to their annual expiration date. And then they must have another triennial on-site survey prior to their 3rd year expiration. Now, with regard to our surveyors, they are professionals. They must attend training course that is about 4 hours, covering concepts and methods for testing compliance with standards, proper documentation, and interacting with the RHC staff. When we release updates and refresher modules electronically, surveyors have a particular time frame in which they must complete this additional training. It is through this robust process outlined that we are confident that the program is sound, our facilities are safe, and we are doing everything possible to protect patients. This is the most effective way to change the conversation with regard to accreditation and make sure that our program is effective. Our surveyors are people who work in and run rural health centers, and they are familiar with the expectations and operations, best practices, and challenges that these facilities face. We do have a routine education program. We do it online. We haven't had an on-site session in quite some time, obviously, as we all have experienced the COVID pandemic, but it is a great way to stay in touch with our surveyors and make sure that they're staying in touch with the standards as well as our policies and procedures with regard to surveyor expectations. Our surveyors are to conduct unbiased assessment. They are there to find the facts. They are there to report the facts. They are there to document the facts. There is a consistent survey method and application that they must follow. Our surveyors address challenges, make clear citations. We follow the rules that Medicare provides us with regard to documenting our survey reports. With regard to corrective actions, making sure that the facility knows that the corrective actions must be undertaken. We identify best practices so that the facilities can benefit from the accreditation process. Our standards are very clear. You're either in compliance or you're not. So it's very clear for the facilities. There's no gray area. Evidence of correction is where we depart a little bit because we actually require that as part of our process. So not only does the facility have to go through the process of telling us what they're going to do to correct the problem, but we're also going to make sure that they provide to us evidence that they corrected it. So that way we have the ability through the monitoring and tracking process to understand what they did to fix the problem, how they make sure to monitor this process, as well as how they're going to make sure it's not going to happen again. So it is a very robust process. We work with the facility all the way through the implementation of corrections. This is our commitment to the patient and the belief that we must work with the center all the way through completion in order to have the most impact. Now, Quad A sees our accredited clinics as our partners in patient safety. Surveys can be extremely stressful. We make it our job to make it educational and not punitive, to create improvements in the RHC and to make the process of value to them and keep working with us. The best way to do that is to communicate about the process, what helps, what does, and what did you learn, and how we can teach better. Our job is not to catch a center doing anything wrong. It is to continue training and improving the bar and making sure that they continue on a routine basis monitoring so that they can remain effective. Now, what we actively teach our facilities to prepare for the survey is because we provide the standards online as complimentary basis, we don't make them pay for the standards. You have every opportunity to prepare adequately because again, you have no idea when we're coming in. So we want you to be prepared. We want to make sure that you have the standards and that you are opening the manual, you're actually reading the manual and seeing how it applies. And they'll find again that because we provide resources such as the CMS guidelines, the CMS SOM, they actually have interpretive guidelines that they can actually use and put in practice at their centers. We actually, we conduct an evaluation of the RHC and they can contact their dedicated specialist pre and post survey so that they can get any type of questions resolved with regard to survey process. At all points, our staff will assist facilities with questions. And in fact, I spoke about our clinical team and they are there to educate with regard to interpretation. So we have a standards mailbox that you can submit questions when you have a question about how it applies to your facility or a question about a standard. And it's a very easy email. So hopefully if you take it down, you have any questions about our standards, it's standards@quada.org. Now, one thing that we obviously want the facilities to understand is the governing body is legally responsible for compliance with all requirements. The survey is based on the standards that are provided and the surveyors are going to survey according to those standards. And that is again, set very consistent with what Medicare requires. The facilities are urged to keep their policies and procedures and other evidence in a manner that, again, they can access very easily, that staff knows where they are, and hopefully they've been updated routinely. Review of policies must occur at least annually, and as well as any process or service changes should be documented with governing body approval again. Ensure policy updates are provided to staff and are documented, and maintain documentation of any staff training or policy updates. That is very key with regard to making sure that they can show evidence of up-to-date information. We talk about that checklist that we have. One of the things that is clear through our survey process is record keeping is always a challenge. So one of the things that we try to encourage organizations to have is a checklist maybe that they can have available that will document what is supposed to be in their personnel charts and how they make sure that those items are in there. And by the way, what is the schedule of making sure that all information is remaining up to date? And these are some of the things that we would expect to see as part of a personnel records personnel record. These are also on our worksheet so that again, the facility could take that worksheet and throughout, maybe every quarter they go and check their files and make sure that they're up to date. Now, fire safety, when touring the facility, surveyors use the floor plan as a reference point to where to inspect. In general, when making observations, surveyors are observing building structure, layout, safety issues, general appearance, and overall cleanliness, such as hopefully you don't have any smells or any molds, any mold anywhere, or any leaks. There are staff and patient interactions that are observed, both clinical and non-clinical. Other staff activities, for example, how is clinical staff supervised? How are clinical records protected? Are infection control precautions observed? Are there adequate number of fire extinguishers available for the size of the facility? And does staff know all their locations? So these are some of the things that the surveyor will engage in to make sure that they're looking at the facility, the physical environment of the facility. With regard to equipment, making sure that maintenance for all equipment has been done and is current with documentation to support what has been done. Ensure that the clinic has policies and documentation for equipment maintenance and inspection. This is something that I think a lot of facilities kind of don't understand, that they should have laws, they should have documentation and biomedical inspection. So again, this is hopefully it's something that the facilities, as we go through the survey process, can learn from. Create a preventive maintenance log of PM program. All equipment should be listed on the PM log. The manufacturer's instructions for use determine the need for inspection versus PM. And that's one of the things that we really encourage, is that you're looking at the manufacturer's instructions. There should be a process in place for tracking due dates or preventive maintenance, as well as evidence of the initial inspection before the equipment was placed into use. Annual biomedical inspections is evident with stickers and reports, and that equipment not in use is labeled as such and stored away. That's one of the other things, that we don't use that, but we don't necessarily label that we don't use it. So again, these are the things that we encourage organizations to do. Now, as a laboratory is required for the rural health setting, these are the 6 lab tests that must be conducted in the clinic. And if the clinics do not provide all the 6 laboratory services, then that must be identified as a deficiency. Clinics must have the ability to perform all 6 tests. The most common one missing is hemoglobin or hematocrit, both provider-based and independent. All controls must be in date, so reagents, strips, etc. Surveyors are asked to verify that the RHC offers the 6 required basic laboratory services on site. If it does not, then is there a state law prohibiting them? Verify that all laboratory services are operating under a current appropriate CLIA certificate. That is one of the key items that, again, facilities want to make sure are up to date, including for additional services provided in the RHC beyond the minimum 6 required. Okay, medications. I think this is an area that we, again, a lot of facilities have trouble with, and hopefully through our processes will improve their medication maintenance and storage. Medications must be stored in a secure location for a clinic in order to avoid contamination or deterioration, avoid disfiguration of labels, maintain the integrity of the packaging to guarantee the quality and potency of the drugs during shelf life, prevent or reduce pilferage, that theft or losses, prevent infestation of pests and vermin. Now, word about samples. Sample medications must also be stored securely. Sample medications should be rotated to avoid expiration, first in, last out. Sample medications must be maintained with accurate dispensing documentation, names, medication, amount dispensed, with accurate medication counts maintained. Employees should not be allowed to access or request free samples. So these are, again, some of the things that we educate facilities to make sure that their medication maintenance is appropriate. And these are some of the other things that we talk about: identify medication review plan and frequency to maybe develop a color coding system. The regulation states all medications and supplies consistent with accepted professional principles. RHCs must demonstrate appropriate storage and preparation of medications and supplies under proper conditions of sanitation, temperature, light, moisture, ventilation, segregation, and security. So again, I think facilities have a lot of expectations with regard to medications, and hopefully they're following their appropriate state and federal laws. Controlled substances. The RHC is required to accurately document and track the receipt and disposition of all scheduled drugs used in the RHC. Drugs classified under Schedule 2 are in double-locked cabinets that are secure, and staff appropriately account for all Schedule 2 narcotics daily. And these will be available for them. Yeah, great, great. Okay, emergency medications, CMS memo on 2019 said, while each category of drugs and biologicals must be considered, all are not required to be stored. An RHC must have those drugs and biologicals that are necessary to provide its medical emergency procedures to common life-threatening injuries and acute illnesses. The RHC should have written policies and procedures for determining what drugs and biologicals are stored to provide emergency services. Policies and procedures should also reflect the process for determining which drugs and biologicals to store, including who is responsible for making that decision. So if the medical director is making the decision, they should be appropriate to what the facility does and what kind of illnesses they could encounter. They should also be able to provide a complete list of drugs, biologicals that are stored and in what quantities. So again, if you're not, somewhere where you get a snake bite, you don't need to store antivenom. So again, just appropriate to what your services are, your location, the patient population. Okay, infection prevention, this is obviously one of the key topics that everyone discusses, and we would be the same with regard to expectations of appropriate training, appropriate PPE, and in fact, that is one of our survey questions prior to entering. Do you have appropriate PPE so that our surveyors certainly could have access, as well as what are their policies? Hand hygiene when appropriate or as appropriate. And clean and dirty areas, making sure that they're appropriately segregated and marked, avoiding cross-contamination when cleaning or disinfecting equipment or any items, and not reusing single-use items. That's one of the key things that we frequently see as an area of concern. Now, making sure all instruments are sterilized properly, you should check your autoclave manufacturer for specific instructions. You must follow manufacturer's guidelines for instrument sterilization to include pre-cleaning instruments, wear PPE, puncture and chemical resistant that are with heavy duty gloves. Don't overfill your autoclave. Don't mix wrapped and unwrapped items. Don't use packs that are wet. Place a biological monitor inside. Run a spore test weekly, and transport your items in a puncture and leak-proof receptacle. So these are, again, some of the things that we try to explain that facilities should be undertaking these processes to ensure appropriate sterility. With emergency preparedness, I think, we've all seen that facilities struggle with this a little bit. There were some changes. We're not going to do a deep dive into this today. Obviously, it's much more expansive than we could go into today. But you'll see that CMS, the condition relies heavily on documentation that certain activities and reviews have been completed in order to demonstrate compliance. You want, because of this, the first tip and technique that we provide to our clinics is assuring the clinic is organized and has all the requirements that would keep and documentation about their compliance in a binder or some type of an electronic file. There's no requirement to do this, but we again try to provide best practices, and we found that this one makes things easier for tracking and monitoring. With regard to emergency preparedness, we want to make sure that we provide them adequate information, that certainly provide the required documentation on the day of survey, whether that survey is by us or a surveyor. We want them always to be prepared. So again, this is an area that we try to instruct facilities that these are key items that need review and ongoing monitoring and documentation to support. Ongoing quality, ensuring that we advise the facility to adhere to a documented quality improvement plan. There's one outlined very clearly, ensure ongoing data-driven QAPI program with participation by all designated staff, making sure to identify areas for improvement, ensuring all quality improvement activities are consistent with the quality plan that you put in place. I think that's one of the key things that facilities are not really engaging their entire staff in that quality improvement activity. Ensure the number and scope of QAPI programs are reflective of the scope and complexity of the facility's services and operations, making sure that they're covering all the areas that, again, the services they provide, the staff, making sure that it's expansive, not just identifying a single problem and moving forward. That's one of the things I think a lot of facilities struggle with, is exactly how to implement and how to keep a quality improvement plan ongoing. So again, we want to make sure that we try to instruct organizations that this is a interaction. It's not just one person. We promote optimal patient safety. One of the things that we do ourselves is we do validation surveys of our process, as well as CMS does conduct validation surveys of us. So we want to make sure that we are finding those areas that are out of compliance for our facilities. We send a survey team within days of a survey and making sure that they are looking at the areas, and then we compare the reports and see where there are any disparities, just as CMS does with all the accrediting organizations. They do validation surveys to make sure that we're, identifying areas, as well as we conduct unannounced surveys based on any identified issue or complaint. We want to make sure that we're getting in there in a timely manner. We are referred sometimes by CMS with regard to complaints, and making sure that we're timely in our response to go to the facility and make sure that we're identifying any areas of compliance issues that arose from that complaint. Now, one of the things that we pride ourselves on is that we actually collect data from our facilities, not our rural health clinics, but our surgical facilities provide us data that help with patient safety and initiatives. We have a patient safety data repository of information. We ask the facilities to report on a quarterly basis. With this data, there have been research that has been conducted. We have a partnership with Harvard that looks at this data and uses for research papers, research efforts. So we're very proud of that. We do have a couple of papers that we can certainly refer to. I don't have them handy, but you can certainly look them up. But again, this demonstrates how we look at our processes and ensure our standards are current, relevant, as well as what data can we glean from our own survey information. So again, we're very proud of the ability to collect data in purpose of research. Now, one of the things I wanted to make sure that we talked about is some of the things that we identify as part of our survey process and some of the strategies that we try to advise facilities so that they can reduce their risk. Now, these are the areas of compliance that are demonstrated in our standards manual that are consistent with what is expected from Medicare as well. Our top cited standard is with regard to making sure that the clinical records are up to date and accurate. We found in 14% of our facilities that they're not having a complete record. As you can see from the requirement, that the patient has that receives healthcare in the clinic, the facility maintains a record that includes identification and social data, evidence of consent forms, pertinent medical history, assessment of the health status and health care needs of the patient, and a brief summary of the episode, disposition, and instruction to patient. Now, this is what we found in our records when we cited the facilities, that there's an incomplete informed consent. A lot missing allergies, reactions to allergies is probably #1 across the board. A lot of facilities miss that with regard to anything that the patient is allergic to, making sure that they document what is the reaction that the patient has. Missing components of the medical history, making sure that it's up to date. missing documentation of patient meds, what medications are taking, dosages, all those things, making sure they're current. Missing instructions provided to patients. You should be documenting what instruction they're given to patients, and that is inconsistently documented, as well as missing the assessment of the health status of the patient. So what we try to tell facilities is that they should routinely review clinical records policies to make sure that all components of the requirements are there, as well as employ a checklist, if you will, of the clinical record components that should be present in every clinical chart. And that way they can follow that as part of their normal process. And we also encourage using our clinical records worksheet so that they can themselves look at that. Now, I will tell you that one of the things that's important to know is that that clinical records worksheet is also the same one that's used by our surveyor to evaluate the compliance. So they're using the very same tool. So there's no mystery in what the surveyor will be looking for. Move on. The next one is with regard to physical plant and environment. The drugs and biologicals are appropriately stored. As we talked about, there's a big medication management issue that a lot of facilities face. So in 8% of our surveys, we identified expired meds. I think we see that across the board in all outpatient settings. Inadequate documentation of open or expired dates. You should be putting labels on medications that are open with regard to their expiration date. So strategies to avoid non-compliance include medication storage environments should have adequate temperature and humidity controls, making sure that the medications are maintained in an appropriate setting according to their instructions, sufficient lighting, clean conditions, cold storage. One of the things that we've identified, if you're not monitoring your refrigerator, that you can keep medications, and you want to make sure that that's working adequately. And if there's any temperature change, you have a way to gauge it. Adequate shelving to ensure the integrity of the stored drugs, adequate locking of mechanisms and security. I think that's another key area, is making sure that the medications are securely secured from inappropriate access. Ensure policies are current and reviewed annually. Review medication storage instructions and maintain medication checklists with expiration dates. Again, those are key things that will help a facility maintain their ongoing medication logs appropriately. And the final one is very consistent with the first deficiency that we identified, is again, clinical records. As you can see, in 8% of the surveys that we identified this very same issue with regard to missing reactions to allergies, physical exam information, not including vitals, missing assessment of health status. So we would employ the same strategies that we encouraged before, making sure that the policies are reflective of what are required as part of a clinical record, employing a clinical records worksheet, as well as using our clinical records worksheet as a way to check on a frequent basis. And with that, I'll entertain any questions. I know I ran through that last two fairly quickly, but that is reflective of what we're actually seeing out in the field. If that helps with some of the struggles of these rural health clinics, these are some of the top things. So any questions? Sure.
So when you do your survey and you come to a clinic to do this, do they sit down with the staff before they leave to say, here's what our findings are, or do they just get a written?
Yes, our surveyors in any survey would sit down with the facility, and the facility determines the staff that are appropriate to be there. They report their factual findings of what they observed during the survey. They do let them know that they will compile all the information, and it goes back to the central office. But in any survey situation, they have to identify with the facility what their findings were. Any other questions?
So in terms of doing your survey, do you do it where you're just randomly picking a record and then go through, or do you, like when I worked with Joint Commission, they followed they took the paper record, then they talked to that clinician, and then they talked to that patient, and do you do it that way, or do you just like go to a department and talk to them?
Okay, with our clinical records, there are, the surveyor is looking at a cross-section of the, patient population, making sure they pick randomly. The facility will not know in advance which records are pulled. And one of the other components is if the patient, the facility is using paper records versus electronic records, the facility still has to have someone there with the surveyor so that they can go through and answer questions. We follow the patient with regard to the survey process, identifying, touch points and conversations and looking at interactions. We do try to follow them through the survey process. But as far as the clinical records review, that is something that is done as a random pull, as well as the personnel records as well. Well, I so appreciate being able to talk to you today. I really have enjoyed myself. I enjoyed meeting all of you, and this has been a wonderful experience for me. So I appreciate taking the time with you today. Thank you for coming. I appreciate it. Thank you.
All right, we've got a quick membership meeting back in the main room, and then we'll go to lunch from there. So you guys are free to go. We'll be back in the main room. Thank you so much. That was great. Oh, yeah.